What do you mean?
Well, like, see how he's like got like the muscles that are in your abdomen that like everyone obviously has,
Right.
but like only like people who like really work out, you can actually see them
Oh, I
like
see
coming
what you're
out.
saying.
But
Yeah.
like we all technically have those.
Right. Yeah, that's right. We do. We
We all have
we just
abs.
can't see them. That's, yeah.
Which is crazy.
Never thought of it that way. All right, so we'll start today with muscle disorders, just one of them. Muscular dystrophy. So in this situation, it's genetic defect. So you're born with this condition where it's missing a gene that makes a protein called dystrophin, which is what helps keep the muscle fibers intact. And so without this protein, the fibers degenerate and atrophy. So they basically break apart, and then the ones that are there get smaller and weaker.
Do they ever put on muscle?
Well, they can get muscle bulk, but the muscle fibers themselves wear away. But what does happen is there's more fat that can develop in the muscle area and connective tissue. And so the muscle can get larger in size, but it's actually weaker because the fibers just break down more and more. So they might not,
Parts of muscle, right?
it is, yeah.
So would they like?
Yeah, they have heart, yeah, they have heart problems.
And people who have this often end up in like wheelchairs.
That's right, they do, yeah.
Because I know someone who does, but he's like, he's super cool, but he's in a wheelchair. It's funny.
Yeah, I mean, it has different severities too. And so
I
there's,
think he is super severe. 'Cause it
Does
said
he?
When he was like a super little kid.
oh,
And he's like 40 now.
oh, well, if he's still alive in his 40s, then he has not the most severe cases, because the ones that are really, really severe, you can't really live past 20s.
I don't
That's-
think he has grown. Like his muscles haven't, like and bones haven't grown since he was probably like 8 though.
Oh, wow. That's pretty bad.
Yeah.
My goodness. But he must have one that's not progressive where it,
Yeah.
because the ones that are the most severe cases, like Duchenne's, like is what's showing you on here, it goes from your extremities, like your fingers, your feet, to your heart, to your chest.
Yeah.
And they usually stop breathing in their 20s with the most severe cases. And so for him, it sounds like it stayed mostly in his limbs and hasn't spread to his chest area, that's really good. But yeah, it's just a really terrible disease.
Is there any cure for it?
Not at this point. Maybe with gene therapy in the future, there would be, because they know the gene that causes this. And you can see on here, this is showing you a normal person's genes. And then these are ones who have Duchenne's muscular dystrophy. That's what DMD stands for. So these are 3 different people. And these, you can see they're missing genes that they should have. And those genes code for a protein called dystrophin, which should build up the muscle. So if you can find a way to inject that gene into the muscle tissue through a virus, for example, then they could be cured of this.
So should we, like, I mean, I feel like we talked about this before, but for like gene therapy, should it be like allowed?
Well, I think in certain situations, like for this, I think it would be a really good reason to use it. Yeah. I think there's nothing immoral about using a virus to give a gene to you that you need. With vaccines, it's really what we do with vaccines. So there's nothing immoral about it on its own. As long as you don't get it through immoral means, through aborted tissue, for example. If it's for a good reason, like curing a disease, then yeah. Now, if you want to just do it for cosmetic reasons, then that would be a bad reason. So several different things can happen from this. You talk about heart function, because your heart's a muscle. Your diaphragm is a muscle that makes you breathe. And so that's usually what happens when it gets life-threatening, is when the diaphragm is impacted. They lose muscle mass, they become weak. They can have inflammation in their muscles, so they can start swelling and get warm or hot because of that. Fibrosis is scarring of the muscles. Your bones can get weaker because muscles build on bone. And so your bones get strong based on the muscle tension. And so if your muscles are weak, your bones become weak. The brain is also impacted as well.
Is your brain a muscle?
It's not, but the dystrophin protein also is needed in your brain to keep the fibers intact. So your brain is not a muscle, it's made of nervous tissue instead of muscle tissue. But it does work in a very similar way to muscle. As far as, if you use it, it gets stronger. If you don't use it, it gets weaker. So that's the way it's similar, but they're different cells. So it starts from the extremities, it starts from the fingers, starts from the feet, and it moves upward to the chest and the head. So there's different kinds of muscular dystrophy, but Duchenne's is the most harmful, the most severe of them all. And for that one, early 20s is usually how long they're expected to live. At that point, it gets their diaphragm.
I have a question. That's not really like, it's more of the diaphragm. Is that the muscle, what's variously voluntary and involuntary? Because like you can stop your, like you can like pause your breathing and you can like slow it down. But at night, you're still breathing. You don't have to think about it.
Yeah, so that one's is kind of in between because it's usually involuntary, but you can make it voluntary. So that would be an example of one that is usually voluntary or usually involuntary, but you can choose to make it voluntary.
Oh.
So the muscle fiber dystrophin helps maintain sarcolemma, which is just this membrane that surrounds a muscle fiber. And so that is impacted. And without that membrane, the muscle fibers just start to break apart. That's why it's called dystrophy. Basically, you've lost that protein dystrophin, which you need in your fibers. But there aren't many muscle disorders. Muscles are pretty resilient to infection, to disorder. So this is one of the really only ones you're going to have. Most of the time, if you can't move a limb, it's usually a nerve problem, so not a muscle problem. So there aren't many muscle disorders. There's a lot of nerve disorders that would cause movement issues.
We're gonna learn like about nerves.
Yeah, the next chapter. Yeah, it's all about nerves in the brain.
That's a good lot.
Yeah, it's a lot.
Just for 1 second.
It's a big chapter.
Are we gonna do the stitches thing?
Well, if your dad wants to come, I mean, have you asked him if he
No, but I
has?
can.
Yeah, see if he has time.
Yeah.
I mean, I was really busy, but yeah, if he has time to come, that'd be good. So we'll see. But I know last year's class seemed to really like it. So the nervous system would develop in the baby before they can control the muscles. So they have the muscles, but they can't really use them without the nervous system working. And so it has to mature before the baby can start to use them. So that's why a baby, when they are first born, can't really move very much. They have their muscles there, but the nervous system is not able to control the muscles. Neural development starts in the head and goes downward through the body. So that's why a baby can lift the head up first before they can crawl, and why they can sit up before they can walk, because the nervous system starts to mature from head downward. It also goes from proximal to distal. So it starts from the center of their body and then works its way outward. So that's why a baby can move their arm before using their hand and their fingers to hold things. Because the arm movement with the nervous system can be controlled, but it's not moved out to the fingers yet to control the hand and the fingers. And by the time you're in your teens, you have a fully functioning nervous system, and it's at its peak. You have the best reflexes of any time in your age, and it works the fastest. And as you get older, after your teen years, it starts to slow down. And that's to do with the myelin that's around the nervous system. You have an insulating myelin, And if it's thick, then it works really well, and you can have good reflexes, good communication with you, so you can think fast, you can move fast. But as you get older, it wears away, and your movements start to get slower because of the neural tissue that is wearing away. And so your muscle tissue also wears away as you get older, but your nervous system controls your muscle. So if that wears down, then your movements also are going to be impacted. No. Sorry.
Is there a way to like prevent it or like slow it down at all?
The nervous system degenerating?
Yeah.
By being active, like using your brain and then exercising is the biggest thing you can do. Having a good diet can also help. Those are the two things you can do. But yeah, being active, like using all parts of your brain. So, reading, being socially active, having friends, talking to people, writing things down, working out every part of the brain, solving problems, crossword puzzles, things like that. Those would all be things that could help you maintain your neural strength.
Do you know if it's true? I just saw this thing and it was just almost like I don't know if it was scientific at all, but it said that journaling has been proven to like help your heart health. Do you know if that's true?
Help your heart health.
Yeah.
I don't know how that would be. I guess it would reduce your stress, maybe.
Yeah.
I guess.
think so.
I don't know. I'll have to look
it
into
said,
that.
If you do like 20 minutes like a day of journaling, it's supposed to help your heart.
I write that down. Looking at.
I mean, I don't know if it's scientific at all. I literally saw it on like the most random post, so it could have just been something somebody made up.
Yeah, all I can think of is that it just reduces your stress, which would then
Yeah.
help your heart. Besides that, I really don't know why else that would be.
Yeah.
Miss Holly, guess what? On my YouTube feed, one of your videos from like your physics class popped up.
Oh, it's funny. Like in the recommended videos. Oh gosh.
Yeah, the algorithm is starting to like you this whole.
Oh man, it's kind of sad. Like I should show you sometime, like all my view count. It's.
Oh no.
Okay.
It's like 3 and 2, like
Let me see if I can find it.
Wait, that sounds bad though.
I'm just gonna go and we'll rewatch every one of them. Relearn
let's see.
physics.
Here we go.
Oh my
it's all this time that
Oh my
0,
gosh.
2, 2,
What the heck
4.
is actually so I always
We'll have to go just watch all of these, Miss Holly.
Oh, I got one like right here.
There we go.
Yeah, it's just pretty sad.
All of your videos
Oh,
are
you
you
got
like.
17 views. on
Yeah, I don't
it.
know what's up with this one.
Wow.
This one's popping for some reason. I don't know.
It was viral.
Oh, dude.
It's like, oh, that's why.
That's what. One time, Mrs. Rudolph, I was on Facebook and she had a picture
Always think of
and she had 6 likes, and she said it went viral.
Oh, are you serious?
Oh my gosh,
That's
no,
hilarious.
And she went like to all the people, did you know my photo went viral?
No.
This
Oh my
is sick.
gosh. You know
So-
what's the most annoying thing? When YouTube comments, when they get like 10 and they're like, OMG, this is the most I've ever gotten. Thank you, everyone. And I'm like,
Yeah.
even if it's a good comment, that would make me not like.
Yeah.
It's just annoying.
Oh my gosh.
That's terrible.
She was so excited.
Oh my gosh. Well, now I'll have to go like all your
Really, it doesn't matter to me, honestly. I mean,
The numbers
That was still so
are-
sad. I was like 0,
I know.
occasionally like a 3. I would leave comments, but I don't get why you have to like start your own channel to comment on everyone's.
Yeah, I know, right?
Because I don't want to start.
Yeah. Mm,
So I'm not gonna do that. But,
no.
you know, I watch your video drops. Oh, I'm gonna put it. I was just kidding. I'll share.
Oh, I should want to rewatch it.
What?
You know what I'm saying? She said she was just kidding. I was like, wow, she wouldn't rewatch
Oh, okay.
your channel.
Well, now I will, and you'll.
We'll make you go back and knows.
So when you age, connective tissue starts to increase. And so you have more, like the tendons are connective tissue. And so you have more of the membrane around the muscles increase, but the muscle fibers themselves decrease. And so your muscles get stringier, they get smaller, they get weaker. And because so much of your body mass is tied to muscles, you lose your body weight too as you get older. And so for its size, muscle is a lot denser than fat. It's one of the densest things in your body. And so if you have the same size, but you have more fat, you're going to weigh less than somebody who has more muscles. And so muscles have a lot more blood in them, have a lot more density than fat does. As you get older, your strength decreases by about 50% by age 80. That's just due to losing your muscle fibers. Also on here, you can see as you get older, if you don't exercise, you're going to lose your mitochondria. You're going to have damaged mitochondria that aren't replaced. The mitochondria are batteries for your muscles. And so you lose your endurance as well. You lose your strength and your endurance as you get older. But if you exercise, even when you're older, you use weights, like little arm weights, and you walk and you use aerobic exercise, then you can start to counteract the mitochondrial damage and counteract the muscle fibers that are lost. So even when you're older, you can repair some of your muscle fibers and maintain some of your strength.
Is that why people who are really old but have exercised regularly their entire life don't like lose the ability to exercise? Like they're still really strong, they can still go on like super long runs?
Exactly, yeah. So it's what you do, when you're younger, but even when you're older too. If you choose to keep on exercising when you get older, you're going to maintain some strength that you wouldn't have had.
Because aren't there like 80-year-olds who are able to run marathons and stuff?
Yeah, that's amazing, yeah. Yeah.
Did you see that? You know that one picture of like the grandma and she's doing like the planks and stuff, like holding herself up with that?
Yeah. That is incredible.
I know, like I can't.
Yeah, I can't even do it right now.
Also on the triathlons that I do, there's like a very large group is like from like 50 to like 60, late 60s. Like that's a big age group for a lot. And there'll be times when I'm like doing it and I'll just see like someone go past me and like see their age is like 60. And I'm like,
Yeah.
how is a 60-year-old beating me?
Just training throughout their life. I mean, they just did that for, for decades, and it wasn't overnight. I mean, they just kept on maintaining exercise.
There, I think it was just a couple days ago, the MLB's like oldest play, like a guy turned 100 who is a Major League Baseball player.
Whoa.
Like he played with like Babe Ruth and stuff, but he's still.
Are you still playing baseball?
No,
He's not still
alive.
playing,
He's
but
still
he was.
alive.
Like he's the
No, he's
oldest
still
like
alive,
baseball
yeah.
player.
Oh, I was like, what? I didn't hear about this.
And then, but then I think they said that last year was the first time he didn't go to a baseball game for the first time since like 1945.
My gosh,
I know.
wow,
Yeah. Yeah.
that is insane.
That's insane.
Wow.
It is crazy.
Because Babe Ruth played like in 1920s. Like he was like 1920s, 1930s, I think.
No, I think he was he?
I thought so.
I think it was 30s.
I think that's when he retired.
He didn't play with Babe Ruth, but there was a picture from like the 1940s. What like Babe Ruth was still.
1914, 1935.
Yeah. So he didn't play with him, but I think he like met him and he like.
Oh, okay. I see.
But that's still pretty crazy.
Yeah. So we have these ones down.
So when do you think our test will be over all this?
I mean, we'll see when people come back after Easter break, but probably Friday,
Okay.
I would think. We'll just see how the week goes. But that's probably my plan for right now is Friday.
Okay, and it's gonna be a pretty big test, right?
Yeah,
Okay.
we covered a lot. I mean,
Okay.
yeah. I mean, I don't think it's going to be a hard test. I mean, compared to some of the earlier tests, it's probably like harder, I think, than the skeletal test, but not harder than the ones you had in like chapter 3 or 4. Like I guess a medium difficulty test.
Man, so this final will probably be a pretty difficult one.
I don't know. I mean, I don't think it's going to be that bad.
You have to have all the stuff memorized for the final.
I mean, everything we covered this year.
It's
It's basically, it's pretty similar to just having all your tests together. I mean, it won't be the same exact questions on your final
Semester or this year?
this semester.
Okay,
So from January to May. It'll be similar to the last final. I mean, it's similar to the final you had in December.
Oh,
And everybody did well in that final. I think most everybody had an A in that on the test.
Wow.
Yeah.
I don't know if they didn't. I mean, most people did or close to it. So close.
I don't remember how, I think I got in the 90s, so yeah.
So it should not be bad. A couple of videos before class ends today. And find them. So I'm going to show you what ACL repair looks like on your knee.
Ow.
Because, you know, ACL injury is a pretty common thing in sports. A lot of people have had either damage to it or have had to have knee surgery. So I'm going to show, and also the meniscus.
They said he was like that far away from having to get surgery on it.
Wait, who?
Like, if his ACL tore like that much more, he would have had to get like totally reconstruction surgery. But he didn't. He just had to go to therapy for like months and brace, but. Pretty close to- Yeah.
Physical therapy is not really expensive.
He's like.
Especially expensive,
It would be
especially.
so expensive, like ACL, yeah. We're very glad he didn't.
There we go.
Your doctor has told you that you have a torn anterior cruciate ligament in your knee and has recommended arthroscopic surgery in order to repair it. But what does that actually mean? The knee is one of the most complex and one of the most important joints in your body. It is made up of bone, ligament, and cartilage. Damage to any individual part can dramatically restrict the normal movement of the leg and can even interfere with the ability to walk. Let's take a look at the way the knee joint is put together. The femur, or thigh bone, meets the fibula and tibia to create a flexible joint called the knee. Helping to stabilize the knee are the ligaments. The ligaments in the knee are strong, flexible cords of tissue that hold the bones together. They maintain stability and allow the normal range of motion when you walk or run. The anterior cruciate ligament, or ACL, guides the tibia, or shin bone. It helps keep your feet below your knees and your legs from buckling as you walk. Twisting or bending the knee during sports or other strenuous activities can damage the ligament. During an injury, patients often report feeling or even hearing a sudden pop in their knee at the exact moment when the ligament tears. Other symptoms include swelling, restricted movement, pain, and even the inability to stand on the affected leg.
On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative
I
by
don't know why they
mouth,
have the background.
and an
picture, but
intravenous
that
line
just
may be
only
put
makes
in.
sense to me, but-
You will then be transferred to the operating table.
In the operating room, a nurse will prepare you for surgery by shaving your leg. The surgeon will then apply antiseptic solution to the skin around the knee and place a sterile drape around the operative site. The anesthesiologist will begin to numb the lower body by
When I first saw
injecting
this, I
a
didn't
drug
even
into the small
recognize
of your
that.
back.
Those people started laughing. I was like, what are you all laughing at? Like, I
To
didn't
perform
know-
arthroscopic surgery,
I always forget
your
when I
doctor
put
will
this
make
mess in
a
there.
few small buttonhole-sized incisions in the area around the knee. An arthroscope is a very small video camera that your doctor uses to see the inside of your knee and to guide the surgery. Before your doctor can insert the arthroscope, the surgical team must inject a clear fluid into the joint. This fluid will inflate the interior space and will help your doctor by providing an unobstructed view and enough room in which to work. The actual surgical instruments will be inserted through one or more other small openings. After verifying that the anterior cruciate ligament, or ACL, has been severed, Your doctor will begin the procedure by removing a piece of tissue from the front of the knee. This tissue, or graft, has bone on both ends and a section of tendon stretched between. Next, the team drills a hole in the end of the thigh bone and another in the top of the shin. These holes become the sockets for the bony ends of the tendon graft taken at the beginning of the procedure. The ligament graft is then inserted into place. When the procedure is complete, the team withdraws the instruments
That's
and the
it.
surgical
Yeah.
fluid drains safely from the
Yeah.
knee.
Yeah, one is for the camera, and then the other one.
Following surgery, sterile dressings are applied. To aid in healing, your knee may be stabilized with a brace, and you'll be encouraged to use crutches during the recovery process.
So do they do the whole?
Yeah, that's amazing. Yeah, just really, I mean, yeah, just 2 holes. That's it. Show you one more video. So it mentioned the meniscus in the video, and I want to show you how they repair the meniscus if that's injured. If I can find it. Let's see which one would that be. Is it this one? Let's see. Yeah, I think it's this one. That is way fast. Nobody's on Zoom anyway, but just in case somebody shows up. Was anybody on Zoom and calculus?
Yes.
Yes.
They were all, oh, okay.
Yeah.
All right.
Even though it's in night?
Well, not Maggie only thinks
Yeah.
it's tense, but everyone else.
Okay. Well, she gets upset when people aren't on
Oh,
Zoom,
good for you.
so.
I'm Dr. Eric Jansen with SportsMed Orthopedic Surgery and Spine Center. Today's video is an explanation on the differences between a meniscectomy and a meniscus repair. Both procedures are performed arthroscopically, as you will see. A meniscectomy means just to remove the torn portion of the meniscus. Here we're looking inside a knee at a torn meniscus. A meniscal tear can cause pain, swelling, and popping in a knee. We're using a shaver here to debride some of the tissue away, and now we're working on the meniscus in this area where you can see both a flap on the medial side and central side. A basket is being used here to clip or trim some of this meniscal tissue away, followed by using a shaver, which you will see here in a second, to remove debris and further clean up the meniscus. We'll continue to repeat this process until we have the meniscus trimmed down to a good stable base. Here we start from the front side of the meniscus and work our way to the central part just to create a good transition zone to complete the meniscectomy. We probe it just to make sure that everything is stable and the way we want.
Is there fluid?
Here before the meniscectomy
Is there fluid?
and after the
Is there fluid like in there, like while they're doing this? To, like,
Yeah, just like the other video, they pump fluid in
Okay.
to make it easier to work with. And there's already fluid naturally in your joints,
I
but they
see that, yeah.
they add more to make it easier to work with.
meniscectomy. Now we'll look at a meniscus repair. We would prefer to repair meniscal tissue if at all possible. Here we can see a large fragment of the meniscus torn and flipped into the center part of the joint. We will gently push it back with a probe and explore it to see if this is truly repairable.
Yeah.
An ideal repairable tear will be just like we see here, where the meniscus is torn from almost its capsular attachment. Here it is mobile and can be pushed back into place. We'll proceed by debriding any little tears along the meniscus, but particularly back behind along the capsule of the joint to stimulate a healing response. Here you can see our insertion device of an anchor that we place through the meniscal tissue and through the capsule of the joint. We basically will place 2 of these down. The first one you can see has been placed, now followed by the second anchor. The suture that are attached to these anchors will then be pulled down and tightened and clipped. We try to attempt to place several of these both on the superior or upper surface as you see here, and they'll be followed by placing them on the lower surface as you will see shortly. Once again, pulling down the second anchor tight and cutting the suture up against the meniscal tissue.
So do those just dissolve?
Yeah, they do over time. Yeah.
Here we'll place the anchors in the undersurface of the meniscus to try to give it extra support and stability. The first anchor has been placed. This is the second anchor that you see being placed here. Once again, we will tighten down the knot
It does. It looks like a rib.
and cut the suture just above the knot. For this particular tear, this will be the final anchors that we will insert. Once again, tightening down the knot and cutting the suture above the knot. Now we inspect and probe the meniscus to make sure that it's very stable against the capsule of the joint.
Really not messed up.
I know, that's what like scared me.
It's like it looks so it looks so-
Once again, before the meniscus repair and after the meniscus repair. For more information on the diagnosis and treatment,
And then it just grows back, you know, so it keeps it in place and it's able to then grow back the way it's supposed to be after
Wait, so
that.
what is the section for?
Well, that's what they were showing. And so they were actually removing the meniscus, like they were
What do you
shaving
do
it.
for? Like, why would you do that?
If it's floating around, like in that first one they showed you, where it's just like a bunch of tissue that was like ragged and floating, it wasn't in place.
So, but like, what cause like something that would do that?
It's usually a sports injury. Yeah, because it's basically a padding for your knee. So if you have any kind, especially like a twisting, like twisting especially is really dangerous. But yeah, any kind of knee injury can impact your meniscus and tear it. In which case they remove the part that's torn, and the part that's not, they just anchor it back into place. They can just regrow. It takes a long time to repair it though, because it's cartilage, and so it doesn't have many blood vessels, so it repairs very slowly. Okay, so for today, in your book, there's just 2 questions to answer. It's 29 and 30. Let's see what page that's on. Page 215, 29 and 30. I'll write on the board for the chapter review question. You want to start on that? I'll sign it next week too, but just in case you want to get a head start on those ones. Sorry.
But so is it just for like muscles is what they do that? Or is it just like for that specific thing that they make holes? And like for other injuries?
Oh, well, it depends on what's happening, but a lot of times you have a cartilage or, you know, ligaments are torn, then they will anchor it back into place and let it repair.
Because I know for my mom, I mean, it was different because she broke her tibia, but like they like did a big old like cut right here on the leg.
Hmm. Well, I wonder if did she have to have screws in there?
She had
So
to
that's-
put in 4 screws.
That's why.